Welcome to wristpain.org. Wrist pain is one of the most common reasons for which patients seek hand surgeons. Because of the importance of the wrist in everyday function, wrist pain can cause significant disruptions to someone's work and lifestyle. Luckily, many types of wrist pain can be treated successfully with non-operative management and, if required, with minimally invasive surgical techniques. The most important factor to consider when evaluating wrist pain is whether it occurred in a traumatic setting or spontaneously. Trauma can cause a vast array of injuries in the wrist, ranging from fractures, sprains, or ligament tears. Fractures and ligament tears are generally caused by higher energy injuries such as falling directly onto the wrist. Fractures are often accompanied by significant pain, swelling, and limitations in wrist motion. Ligament tears, while also painful, are usually accompanied by less swelling and less pain with wrist motion. Fractures and ligament tears can be treated both operatively and non-operatively depending on the displacement of the fracture or degree of ligament tear. Minimally displaced fractures and partially torn ligaments can usually be treated with temporary immobilization in cast or splint. Some partial ligament injuries can be treated with a steroid injection for pain relief. Displaced fractures and completely torn ligaments may require surgery to fix the injured structure. It is important to see a hand surgeon immediately after a traumatic injury, as prompt treatment is required in many cases to optimize your outcome. Spontaneously occurring wrist pain is commonly a sign of inflammation. Inflammation often accompanies tendons in the form of tendinitis or arthritis. While tendinitis can occur in any tendon of the wrist, one of the most commonly involved tendons are the tendons that move the thumb, called de Quervain's tenosynovitis. This condition is very successfully treated with steroid injections. Resistant cases are treated with a minor procedure which can be completed with just local anesthesia. Wrist arthritis occurs generally in the older population but can occur in patients with a remote history of a wrist injury. One of the most common causes of arthritis occurs at the base of the thumb and can present as wrist pain. Treatment for all types of arthritis is initially non-operative with immobilization and injections. For severe cases, surgery to remove the arthritis is often very successful in restoring a more functional wrist. Thank you for listening. I hope this video has been helpful as you try to understand what may be causing your wrist pain. Wrist pain can be very complex. Make sure you seek a consultation with a fellowship-trained hand surgeon early to ensure that you have the best possible outcome.